One of the things that we have invested in Texas Health Aetna is really looking at personalization in a local level. And so with that, in terms of an investment of our virtual care solutions, we have partnered with SiriusMD in developing a solution that allowed us to offer 24/7 access to our ER doctors as part of our clinically integrated network to any of our health plan members at no cost. And so what it creates in a marketplace such as Dallas-Fort Worth, where traditionally is a high cost marketplace that traditionally also has a high utilization of emergency rooms, we are able to essentially create a more convenient and seamless experience for the member, where we're not only essentially providing an alternative to an ER in that same platform. We have other care delivery partners in the platform that allows us to essentially redirect that care back to the primary care provider, in addition to being able to take care on the platform most of the healthcare issues that they may have.
Sort of in the same way that surgery has moved from the hospital into ambulatory surgery centers, you need to know that when you do that, you're doing so in a way that is safe. The same thing is true in telehealth venues. You need to know, as you are beginning to move into more and more complex areas, you are doing so in a way that's safe, driving quality, and that can move and redirect that patient in a smooth and actually satisfying way into a different venue of care that may be better suited. And it's not just the medical record continuity that's important. In our environment, we have to own the whole experience. And that means patients coming to us, members coming to us who have a clinical and financial question, coverage question. We need to be able to help them to navigate effectively through those different sources of insight and solutions to their problems in ways that are continually more and more gratifying. The Cirrus chat with a doc is a good example, because it's chat with a doc and it's chat with financial folks and member services, and being able to help patients, members navigate across those different kinds of venues to get their answers to the questions that they have, I think is really important.
Because the intent of the platform for us is not necessary to replace primary care. We believe that every Texas Health Aetna member deserves a good, engaged, high-quality primary care provider that is incentivized to manage my members' care, particularly if they have chronic conditions or a rising risk or a high-risk condition. But in terms of making sure that integration though happens, we ensured that coordination as well by staffing only clinically integrated doctors as part of our model. So one of the things about our model is that our ER doctors that are on the platform are part of our clinically integrated network, which means that they have access to that member's patient health record and is able to also coordinate that experience back to primary care. What we're trying to just offer is a different additional access point to the member, particularly in an area like DFW, where primary care access continues to be challenging. As much as 40% of my members historically have not had any relationship with a primary care provider, and so continually promoting additional access points and meeting our consumers' needs to where they're at and giving them alternatives such as the ones that we have with SiriusMD allows us to really give a level of consumer-centric options to our members. Why is it that in a banking industry you can get 24/7 support when you need it, yet in many of our communities, unfortunately, we are limited in terms of office hours or geographic locations. And so one of the things that we are seeing is a consumer base that is looking for asynchronous communication, a different way to communicate and interact with their health plan. And it doesn't matter if their issue is related to the provider side of the house or the health plan system of the house. Ultimately, they want a simplified member experience, and so wants to have a simple interface to get their issues resolved in an efficient way. And in our development here in Texas Health Aetna, our virtual platform allows us to accomplish both.
The question is the fact that the technology exists and the ability exists to do a lot of asynchronous exchange of information, again, working to solve problems for patients. And why should we think that doing the exchange of information in a direct one-to-one synchronous way is any inherently better than doing so asynchronously? And if you can solve problems in an asynchronous manner, why not pay for it? I think, is that an accurate way of asking the question?
That's exactly my view.
Yep, yeah. I think that's exactly the way we should look at it. It's not so much the methods or mechanisms used to solve the problem. It's whether or not you're creating an efficient and effective way to solve that problem and move on to the next step of care, further diagnosis, or whatever it happens to be. I'm chuckling a little bit in my own